Hey everyone, SciLife here, and today I'm going to explain why the United States needs a universal healthcare system like other countries. And here we go. First off, before I get into why our healthcare system needs reform, I would like to point out that it's not because of the Patient Protection and Affordable Care Act, or dubbed ObamaCare, that was signed into law of March 23rd of 2010. The healthcare in America prior to Obamacare was arguably quite terrible, especially when you compare it to other developed countries. The healthcare system can be summarized as highly capitalistic, and you can argue that the healthcare providers are out there just to get money and not to help people. Well, of course, this does not mean that hospitals and doctors are not there to help people, but I mean that the system is making a lot more money than what is actually required to run the hospital and pay for whatever procedure or visit that you need. And this includes all the wages for the doctors, nurses, and anyone that's working at the hospital, the equipment and the costs to run the hospital, and everything else in between. If you have an MRI in your neck region in the States, it'll run you approximately $1,500. Well, that's a good deal, right? Wrong. If you go to Japan, that same MRI with the same expertise and the same equipment will cost you about $98 instead. In many other European countries, the cost of healthcare is also substantially less than the cost of healthcare here, and in many cases, the patients don't have to pay anything. This can be attributed to strict cost controls over there, which drives innovation, which actually drives the efficiency of equipment and laboratory procedures and anything else to drive down the overall cost. Where at least in America, you have shorter waiting times than other countries with universal healthcare systems, right? Well, that's also wrong. In several developed European countries such as England, Switzerland, and Germany, their waiting times are substantially less than ours. And if you go to Japan, you can just walk in and have your appointment that day, and 2 days later you can have your appointment for surgery. And that's how much easier it is in other countries. So the whole argument that waiting times are shorter here is not really good. Why do we actually need healthcare reform? Well, let's look at the statistics for, on average, how much the United States spends for healthcare. In 2010, we spent approximately $2.7 trillion, or 17.6% of our total GDP, on healthcare, while almost every other nation was under 12% of their total GDP. Well, that should mean that our healthcare should be better on average since we're spending so much more money, right? Well, it's not. In 2008, we had the most deaths from injury and disease. From 2005 to 2009, we had the highest infant mortality rate. And in 2007, we had the lowest life expectancy rate out of most developed nations. As of last year, we are the second most obese nation in the world, only behind Mexico, who prior to last year, we were the most obese. Out of other developed nations, we have the highest teen pregnancy rate, we have the second highest prevalence of HIV, and the highest of AIDS, and we have the second most deaths from heart disease. To further prove why the healthcare system here should emulate other healthcare systems, we forced about 700,000 Americans annually into bankruptcy, just from healthcare costs. Where in France, Germany, Britain, and Japan, those numbers are unanimously zero. It just doesn't happen in other nations. In the end, other healthcare systems are considered better because regardless of how much money you make, everyone is still covered with health insurance or some sort of healthcare. And many people don't have it at all here in the United States. The key difference is that foreign healthcare plans exist only to pay for the medical bills and pay for the wages of the doctors and not to make money. The United States is literally the only developed nation that allows insurance companies to profit from basic healthcare coverage. Well, what should we do about it then? That is actually where the Affordable Care Act, or again, Obamacare, comes in to help. When it was first devised or put forward to Congress by the Obama administration, it was actually supposed to emulate what the universal healthcare systems are like in the European nations. However, after going through Congress, it didn't really come out that way. Previously to the Affordable Care Act, insurance companies could deny coverage to someone who had a pre-existing medical condition or had a medical condition in the past, simply because they didn't want to lose money. And, well, with the Affordable Care Act, that can no longer happen. They can't deny you the coverage. As of 2013, there were approximately 44 million Americans who were not covered with insurance. And that's approximately 16% of our total population. The majority of the uninsured were working families who simply could not afford insurance with the wages that they were making. And that's not because they weren't making enough money, that's because the insurance costed that much. One of the major things that Obamacare does is help individuals or families get covered with insurance by expanding Medicaid or Medicare for people who need it. They also offer cost assistance and many other things that help people get insurance. By the end of 2014, only about 13% of the total population was uninsured. That's a difference of 3%, or quite a lot of people. While it obviously did not cover everything that Obamacare does or what it should be doing, and that the new healthcare system is on a slow roll right now, it's definitely a step into the right direction. These are just a few examples of why our current healthcare system doesn't work, why this capitalistic healthcare system doesn't work, and why we shouldn't just take it absent-mindedly anymore. Now, that's all I have for you today, so if you like this video, please like that button down below. If you want to see more videos like this, please subscribe, and I hope you guys all have a good day. Take care.